Hi everybody, we're going to pick up with the blood vessel chapter, and this begins in your course pack on page 51. First, we're going to talk about the three layers of a generalized blood vessel. These three layers may not apply to all blood vessels, but we will discuss them here nonetheless. The three layers are called tunicas. Tunica means layer. We're going to start with the innermost layer called the tunica intima. It is composed of an endothelium lining for the inside of the vessel. Now, this is made up of squamous tissue, simple squamous tissue. We know that type of epithelial tissue here is formed in a single layer. The next layer is a middle layer called tunica media. That may be easy to remember because media sounds like medial or middle. In this layer, you may find smooth muscle, or you may find elastic fibers, or some combination of the two. Let's talk for a moment about smooth muscle. We know smooth muscle is involuntarily controlled muscle tissue. So it can respond by constricting or contracting the vessel. That will decrease the diameter and increase the blood pressure. Or that smooth muscle layer can relax, causing the vessel diameter to increase, thereby lowering the blood pressure. Let's talk about elastic fibers for just a moment. Elastic fibers are meant to stretch and recoil back to the original shape. If you think about a rubber band for just a moment, elastic fibers, like rubber bands, should have stretch and recoil ability. Now, the outermost layer is called tunica adventitia or tunica externa, and this layer is composed of collagen fibers. Keep in mind that collagen fibers are strong steel-like cables, and here they play a role in producing a structure that keeps this vessel from overexpanding. If it stretches too far, it could rupture. So think of the collagen fibers as providing steel structure support around the outside structure of this artery or any other vessel. Let's talk for a moment about that tunica media once again. This middle layer can be composed of smooth muscle tissue. Like I mentioned, when the nervous system stimulates that layer, it may constrict, a process we call vasoconstriction. When the stimulation stops, then the vessel relaxes. So I'll go ahead and mention now that the autonomic nervous system branch, called the sympathetic nervous system, is the one that innervates these vessel tunica media. It is the system that can change the diameter of these vessels. There is no parasympathetic innervation to these vessels. So in order to relax a vessel, you just simply have to stop stimulating it. So we'll talk about this again on a couple pages later. Let's focus now on arteries. We know that arteries typically carry blood away from the heart. A for arteries and A for away. Great thing to remember there. We also find that they are colored red on models like you see here in this picture. That red coloration is due to the oxygen carried in the blood. Most arteries, not all, carry oxygenated blood. Most arteries also have some type of thicker tunica media to handle the strong pressure, high pressure that's coming through. And we can classify arteries in two types. We can classify them as elastic arteries or as muscular arteries. Here you can see the thicker tunica media in an artery. And of course, there are two arteries that lead blood away from the heart. The obvious one is this aorta traveling here. And the other one is the pulmonary trunk that splits into a set of pulmonary arteries traveling toward the lungs. Now you may notice that aorta is red while the pulmonary arteries and trunk are blue in color. Why the difference? Well, the aorta carries oxygenated blood, and the pulmonary arteries carry blood that's high in CO2 but low in oxygen. So we say that the pulmonary arteries carry deoxygenated blood. Here's a poem for you. Arteries are red, veins are blue. In the heart there's an exception of two. Of course, those exceptions are our pulmonaries. Pulmonary arteries are colored blue, while pulmonary veins are colored red. Here's the pulmonary veins back here on the back. They don't look very red in this picture, but they are in fact carrying oxygenated blood to the left atrium. So let me repeat here. Arteries always carry blood away from the heart. Pulmonary arteries fit that bill. But pulmonary arteries do not carry oxygenated blood. Instead, they carry deoxygenated blood, meaning blood that's high in CO2 and low in oxygen. Pulmonary veins fit the bill of being a vein. They return blood back to the heart. However, they just happen to carry blood that is highly oxygenated, opposite to what we normally see in a vein. Let's talk now about elastic and muscular arteries. Elastic arteries are thick-walled. They contain a stretchy protein fiber called elastin, and these are conducting arteries, meaning they are conducting blood away from the heart. Notice the examples. All of these are found close by the heart and operate under high pressure. The aorta, pulmonary trunk, common carotid arteries, and subclavian arteries all are classified as elastic. That means they can stretch when blood is pulsated through, and they can recoil back when that blood has traveled past. So there's definitely a flow of blood that's going through here that causes these vessels to need the stretchiness that is lended to them by elastin. Notice that muscular arteries tend to have more smooth muscle than elastin, and that's because smooth muscle can constrict to change the blood flow and the pressure of that blood traveling through. These particular vessels carry blood to specific organs or body parts. That's why they have names for their body parts. For instance, the femoral artery is named for the location in the leg. The radial artery is named for the bone in the arm. So for most of the time, you're going to be able to spot a muscular artery simply because it's named for a location that it serves. Now, these muscular arteries are ones that are used for pulse points or pressure points. These are the ones where you normally take your blood pressure. Here's an example of how you can take your blood pressure using the radial artery. You can use 2 fingers to push down and cause the blood flow to stop through that vessel. As blood pulses up against it, you're going to actually feel pulsations, and that's of course the pulse that we're going to count. In people who have a hard to detect pulse, you can use 3 fingers. In this case, use this ring finger here to block the flow of blood in the vessel, and use these 2 first fingers to gently place over the vessel and feel the blood pulsating up against that blockage. Now, in addition to the radial artery, there's other places in the body where we can detect a pulse. And most of the time we find these in our muscular arteries, but of course the apex of the heart is not a muscular artery there, nor the carotids. They are considered to be elastic arteries. We often hear not to take a pulse with your thumb. Why is that? Your thumb has its own pulse as well. So if you're taking someone else's pulse using your thumb, you're in fact taking your own pulse. Let's look at elastic arteries. You'll notice there's a lot of squiggly elastic fibers in this tunica media. That's because these vessels are built for the stretchiness that needs to accommodate high blood pressure traveling through. Here's an elastic artery that's relaxed. It almost looks like the waistband of a pair of underwear. See how it kind of squiggles up on us here? But in fact, the elastic fibers would be in the walls of this vessel, not in the lining. By contrast, here's a muscular artery. You'll notice that thick, smooth muscle here. We've got quite a bit of it in this tunica media. And the tunica adventitia is meant to be collagen fibers that provide support for the outside of that vessel, prevents it from overexpanding. By comparison, you can see the elastic artery has lots of these squiggly elastic fibers. Muscular arteries tend to have less of them. Let me repeat again. Muscular arteries are the ones that we can control blood flow to particular areas. The vessel can constrict through vasoconstriction or dilate through vasodilation to either increase flow of blood to an area or decrease that blood flow to an area. That's all something we're going to explore in a couple of pages. Veins, of course, carry blood back to the heart. They are typically colored blue because the blood they are carrying is deoxygenated blood. Deoxygenated means it is low in oxygen and high in carbon dioxide. Now, because these vessels operate under low pressure, they tend to have a thinner tunica media than do arteries. So there is some smooth muscle in the walls of these veins, but we're not looking at high pressure through these vessels. All right, so can you identify the veins returning blood to the heart? Well, we have SVC that's clearly visible, and IVC. They are colored blue as we would expect because they carry deoxygenated blood. And then we have 4 pulmonary veins here, and of course they carry oxygenated blood back to the heart. So they are the exception to the rule of arteries being red and veins being blue. Now, since veins are under low pressure, we need some things that help us return blood back to the heart. Imagine standing all day on your feet. The blood has a tendency to pull due to gravity down toward your feet. So we have valves and larger veins that help to keep blood from backflowing and pulling, just as we do in the heart. Your skeletal muscle activity acts as a pump to help return blood back to the heart. So simply you moving about, physical activity, will help to move blood back. And we also have the respiratory system acting as a pump. Breathing and deep breathing can help to move blood from areas of pressure in your legs back to lower pressure in your chest cavity. Here you can see how smooth muscles will contract around those veins, and it milks that blood through valves. The valves will in turn close, like this one here, and the blood has a more difficult time draining back down to the lower extremities and pooling there. Of course now, if you've got high pressure, that can cause those valves to fail, and the blood then can pool back in the extremities. Here's how these valves work. They are meant to allow blood to flow through one way, and after the blood travels through, they're meant to close and prevent that blood from backflowing and pooling. Here you can see a cool looking vein inside this vessel right there, cool looking valve there, and of course that is meant to keep blood from backflowing. Just a view of another one. And for people who come through surgery, we must have a way to help milk that blood flow back to their heart, and that's where these pneumatic pumps or leg compression boots come into play. They keep blood from clotting in the legs, and by constantly compressing and relaxing, they act to serve as the skeletal muscle pump to help move that blood along back to the heart. In places where we see valves fail, then we end up with what we call varicose veins. Nowadays we do have a way to provide a solution for this, but you can see them on the surface of the skin here very easily where the valves have failed and that blood has backflowed. Okay, so there's a really gnarly looking varicose vein there on the left. And by the way, hemorrhoids are varicose veins. Pressure to have a bowel movement can cause the valves and the veins around the rectal and anal areas to fail, and of course those can fill up with blood and then bleed. So before we leave this page behind, let me also mention that small arteries are called arterioles and small veins are called venules. Okay, so arteries are larger than arterioles, veins of course are larger than venules, and you can easily tell the difference here between an artery and a vein due to the fact that the artery has a much thicker tunica media than does that vein. Another view of a large artery, thick muscular wall here. Notice that's not any elastic fibers here. Okay, vein has a much thinner wall. And by comparison, you've got an arteriole and a venule here. Notice they're much smaller in diameter. That's because they are simply smaller versions of arteries and veins. All right, let me take you over and talk about capillaries for just a moment. They're found on the top of page 52. You'll notice that this capillary is very thin-walled. In fact, that's a blood cell traveling through. Here you can see more capillaries. Right here is a great-looking one traveling through with single-filed red blood cells. These particular vessels are so small that they are made only of tunica intima. And they are so small that cells have to travel through in a single file. That's one of the reasons that erythrocytes need to be flexible. They need to be able to squeeze through and travel through these arteries. So a really neat picture here of skeletal muscle tissue and a singular capillary traveling through that area. So capillaries come in two major types. They can be closed or continuous capillaries like you see on the left, or they may be fenestrated like you see on the right. The capillary on the left is closed because it is not going to exchange nutrients, fluids, waste products with the surrounding cells and tissues, while the capillary on the right is built exactly to do that. So these fenestrations that you see on the right are porous openings in this vessel that allows for a great exchange of fluids, nutrients, waste products, whatnot, with the surrounding cells and tissues. So one great example of a closed capillary system is the blood-brain barrier in the brain, We don't want exchanges in that particular setup. Fenestrated capillaries are found in places where you do want a great deal of exchange, places like your liver and spleen, for instance. So capillaries don't exist as just a simple connection between an arteriole, which you see here on the left, and a venule, which you see here on the right. Of course, blood flows through in this pathway. What we in fact see are networks of capillaries that we call a capillary bed. So capillaries are a place where we can have a great deal of exchange, whether it's nutrients and waste products, fluids, or even gases. We are able to exchange these things with the environment, which is the surrounding cells and tissues. Now, if you want to close off that exchange, you may use sphincters here to prevent the exchange and allow for just a single flow of blood through that main capillary, that thoroughfare channel here, and allow that blood to reach the venule on the other side. You're actually already familiar with this, whether or not you realize it. Back in Bio 210, we talked about how temperature affects our blood flow. We know that cold temperatures will close off the blood flow to a particular area. So which picture do you think represents cold temperatures? That might be this bottom picture, okay? That's because cold temperatures will cause those sphincters to contract, and blood will then be shunted directly from arteriole to venule. Warm temperatures do what we see at the top picture, opens up those sphincters and allows for great blood flow and exchange among those capillaries and surrounding cells and tissues.